Namaste. Good afternoon. Uh, I am welcome to today's session. Uh, this is Dr. Aparna. I am your emotional healing synergist. I am an Ayurvedic psychotherapist, a passionate infopreneur, edupreneur, and medical writer. So I am on a pursuit to address, promote, and propagate Ayurveda and psychotherapy globally. In this pursuit, every week or thrice a week, I come up with any topic of discussion, or I call on, I interview some of the guests from the field or the professionals from the field of Ayurveda or mental health or psychotherapy. So, this today's topic of discussion is social anxiety disorder. See, this is the most common, mental health disorder, and it is very common. We all experience social anxiety, but we are going to discuss when it is to be considered as mental health illness and what is social anxiety disorder, uh, what are its types, what are the symptoms, what are the causes, what is its management. We are going to discuss it all. So let's get started. So to begin with, it is normal to feel nervous in some social situations. For example, going, if you, when giving a public talk or giving a presentation, it may cause the feeling of butterflies in your stomach. But in social anxiety disorder, also called as social phobia, earlier social anxiety disorder was also called social phobia. And but in this social anxiety disorder, everyday interactions cause significant anxiety, self-consciousness, and embarrassment because you fear being scrutinized or judged negatively by others every moment. That means, simply, if a person, if it is normal when you go to, when you are about to give a presentation, or when you are about to give a talk, or when you are about to meet new people, or when you are going for an interview, it is normal to feel a bit of anxiety and nervousness. We all feel that. But for the people who have social anxiety disorder, they can't even go and, they avoid being in social circumstances because they are very much self conscious, and they feel they could be embarrassed and humiliated and scrutinized or judged every moment negatively by others. That means we call it a spotlight syndrome. So what a spotlight syndrome is, a person feels that everybody, you know everybody in the hall or in the function or wherever there is a social gathering, everybody is only concentrating on that person, like judging and scrutinizing and talking or about that person. It is just an internal thinking. It is not real. But a person who has social anxiety disorder feels that he's always being judged. Every person in the room or in the hall is talking about him, is looking at him, is scrutinizing him or her, or is making judgments. So this, due to this fear of, being scrutinized, they don't even go to a social gathering, or they don't even, that means it interferes in their normal life. So, social anxiety disorder, also known as social phobia, is a mental health. condition characterized by an intense and persistent fear of social situations or performance situations. At times, it is also called performance anxiety. So, individuals with social anxiety disorder often experience significant distress and anxiety in situations where they might be observed, judged, or evaluated by others. This fear is typically disproportionate of the actual threat to people posed by the situation and interferes with their daily functioning and quality of life. See, when what how to differentiate? If you ask me how to differentiate between a normal, the a normal anxiety that and a an abnormal social anxiety disorder. We all experience anxiety at times. It is normal. Excuse me. But when this anxiety interferes into your normal life, that means everyday activities are being hampered or disrupted by this, then it needs to be considered as a illness, mental health illness. Then there is a problem. That means, if suppose if you have an anxiety or nervousness before you're going to a public talk, and after few moments, like seconds or minutes, you're comfortable and you're talking, it is just before the talk or before an interview, you're fine afterwards, that is good. But if you, with the fear of being humiliated or embarrassed or being scrutinized of your negative thoughts, you don't even go to the stage, you avoid going to the public talks, you avoid going to interviews, you avoid going to social functions, or you just avoid and find excuses to escape from social scenarios because of the fear of because of fear. And you also experience physical symptoms, not only the fear, but people start experiencing physical symptoms. So this is when their functioning and quality of the daily life is affected. So this is called social anxiety disorder. So, and it may occur due to, we'll talk about the causes in the session. So, it may occur due to genetics and environmental factors. It is, as I told, it is, it is also called social phobia. Phobia is an irrational fear of certain objects or situations. It is irrational fear. That means the fear is not realistic. What is realistic fear? Realistic fear is, if you if you find a snake in front of you, or if somebody is pointing a gun to you and they're about to shoot you, that fear of the snake bite or the gun is the realistic fear. But this fear is an irrational fear. This fear is existent only in your mind. It is not the actual existent, because nobody has the time and the attention span to only think about you, only judge you or scrutinize you. It is just happening in the mind. So there is a difference here, irrational fear and the realistic fear. So here there is only irrational fear. So social anxiety disorder, in social anxiety disorder, fear and anxiety lead to avoidance that can disrupt your life. Severe stress can affect your relationships, daily routines, work, school, or other activities. So social anxiety disorder can be a chronic mental health condition, but learning coping skills in psychotherapy and taking medications can help you gain confidence and improve your ability to interact with others. See, people with social anxiety disorder are fearful or anxious or about some social situations due to a fear of negative judgment, embarrassment, or rejection, as I told you already. So, although some anxiety is usual in social situations, such as when giving a presentation or going on a public talk, or social anxiety disorder refers to anxiety that is intense, affects work or personal life, and lasts. It is long lasting actually. So, what are many people also have strong physical symptoms such as increased heart rate, feeling sick or sweating. So what actually happens in social anxiety disorder? Although the person may acknowledge that their fear is excessive, the anxiety often feels overpowering and out of their control. The triggers of social anxiety vary among people. See, the triggers and the symptoms may differ from person to person. That means people may experience different physical symptoms and mental symptoms and behaviors. It might not be same for all. Some people might not feel will feel uncomfortable meeting unfamiliar people, and they will feel uncomfortable or avoid talking to people at work or school. And children maybe maybe not comfortable to speak in class, and having to talk to a cashier in a store using everything. They are afraid of being eating or drinking in public, and to perform, to dance or sing or talk in front of others. So there is a difference. See, there is a difference in being shy and social anxiety disorder. People often confuse these both. Being shy is a personality trait, it is natural, but social anxiety disorder is a mental health illness. See, being shy is a natural trait. A person does not want to mingle with people is different from a person having fear, anxiety, experiencing sweat and increased heart rate to meet people. This can be, see, shyness can be improved, or it is a self-help situation, and it is a natural trait where they don't experience any physical symptoms, and they are not avoiding the situation for being embarrassed, rejected or scrutinization. Here in social anxiety, they are avoiding social gatherings because of the fear of embarrassment, humiliation, being scrutinized and judgment. So shyness is different from social anxiety disorder. Don't confuse that. If you're a shy person, that does not mean that you have a social anxiety disorder, though both may need some help. If even if you're shy, you have to build confidence and improve yourself. Both may need help, but this is a personality trait. One is a personality trait and one is a mental health illness. So how common is social anxiety disorder? Social anxiety disorder isn't uncommon. Approximately 5 to 10 percent of the people across the world have social anxiety disorder. It is the third most common mental health condition, behind substance use disorder and depression. See, after depression and substance abuse, that is drugs and substance use, this is the third common mental health condition is social anxiety. So if you ask, are there any types of social anxiety? Yes, in social anxiety also there are types, like mild social anxiety, moderate social anxiety, extreme social anxiety. Some people with social anxiety only experience symptoms with one type of situation, like for example eating in front of others or performing in front of others, while other people with social anxiety experience in several or all forms forms of social interactions in general. There are different levels of social anxiety. So what is mild social anxiety? A person with mild social anxiety may experience the physical and psychological symptoms of social anxiety, but still participates in or endure in social situations. This person, no, does not avoid social situations completely. They may also only experience some symptoms in certain social situations, that is selective. Only in selective cases, no, they experience anxiety and physical symptoms. In all other circumstances, they do not. So this is called mild social anxiety. So what is moderate social anxiety? A person with mild social anxiety may experience physical and psychological symptoms of social anxiety, but still participate in some social situations while avoiding. So here in moderate, they avoid some social situations which they are severely, in which they experience severe anxiety. May it be talking, giving public talks, or giving presentations, or video conferences, or whatever selective, they avoid. They start avoiding in moderate social anxiety. They participate in few, or they start avoiding going to social gatherings because of being judged, because of their appearance, or their speech, or their intellect, etc. There may be, different scenarios different people might experience. And in extreme social anxiety, a person with extreme social anxiety may experience more intense symptoms of social anxiety, such as panic attacks. He might have panic attacks in social situations. Because of this, people with extreme social anxiety usually avoid social situations at all costs. These people find excuses and avoid social situation at all costs. A person with extreme social anxiety likely has symptoms in all or many types of social situations. So this, okay, and whatever I told, like, again, what is the difference between having social anxiety and being shy? This is a very important thing when it comes to, diagnosis as well. People often confuse the social anxiety with shy. Oh, he is shy, that's why he is not, he or she is not approaching a therapist. It is a part of his personality. No, social anxiety disorder is not part of the personality, but being shy is. So anyone can experience shyness from time to time. Having social anxiety disorder consistently interferes with or prevents you from doing your daily life activities, such as going to grocery store or talking to other people. Because of this, social anxiety disorder can negatively affect your education, your career, and personal relationships. Being shy from time to time doesn't affect your daily activities. So being shy, as I already said, being shy doesn't affect your daily activities, but having social anxiety disorder does affect your daily activities. The minimum normal activities, like going to a grocery store, talking to the cashier or people over there, meeting strangers, and it might have negative effect on your education, career, and personal relationships. So in general, the three main factors that distinguish social anxiety from shyness are how much it interferes with your day to day life, how intense your fear and anxiety are, how much you avoid certain situations. Okay, shy people do not avoid every situation, they're shy for a selective circumstance only. So many people with social anxiety disorder don't try to get help or seek treatment because they think social anxiety is just part of their personality. It's important to reach out to your healthcare professional if you are experiencing ongoing and intense symptoms when in social situations. So symptoms and causes. So what causes social anxiety disorder? So causes of social anxiety disorder, it may be biological. So certain genetic and biological factors may contribute to the development of social anxiety. It is believed that imbalances in brain chemicals such as serotonin play a role in regulating anxiety and fear responses. That means in your near family or your any of the relative or the parents, if they have social anxiety disorder, it might get transferred to the offsprings as well. So environmental factors, negative experiences in social situations such as bullying, humiliation or rejection can contribute to the development of social anxiety. So social anxiety can be developed. How? Because of the negative experiences, such as children being bullied at school, or people being humiliated or rejected at times, and being scrutinized or being taunted, or being it happening frequently. So, traumatic events or an overly critical upbringing may also be contributing factors. If they have an overly critical parents and upbringing who scrutinize every bit of their children, okay, parenting also plays a role. Next, what are the cognitive factors? These we discussed biological factors, we discussed environmental factors, we are now discussing cognitive factors. So, individuals with social anxiety often have negative thoughts and beliefs about themselves. They always have inferiority complex, leading to self consciousness and fear of judgment. They're always self conscious. As I told, the spotlight syndrome. They think that everybody is thinking about them, everybody is judging them, everybody is scrutinizing them. That is not real. People don't have so much time to do. They may excessively worry about embarrassing themselves or being seen as an inadequate or inferior. They always have the inferiority complex. So these are the cognitive factors. And what are the social factors? Social factors are cultural and societal factors, can influence the development of social anxiety. High societal expectation, an emphasis on appearance or achievement, or a fear of social scrutiny. See, we are always, society scrutinizes us for the appearance and the success and the achievements. It may be personal, it may be professional, everything. Excessive social scrutiny, being socially scrutinized excessively, can also contribute in developing social anxiety disorder. Once or twice, a person may experience a scrutiny on himself or her, and that becomes permanent in the mind. So, social anxiety disorder is a complex condition to study. Researchers are also looking into how stress and environmental factors could contribute to social anxiety. So, this we discussed the causes. So, what are the actual signs and symptoms? Let's delve into the signs and symptoms of social anxiety disorder. So, when people with social anxiety have to perform or in front of people or be around other people, they tend to experience certain symptoms, behaviors, and thoughts. A person with social anxiety disorder can have these symptoms during specific types of social situations, or they can have them in several or all social interactions. Physical and physiological symptoms of social anxiety are like blushing and sweating, or shaking, or shaking of hands, or trembling of hands, and a raised heartbeat, and feeling very nervous to the point of feeling nauseated. They feel so much nervous that they have nausea, and not making much eye contact when interacting with others. They don't have the eye contact when interacting with others. Having a stiff body posture when you are around other people. So having a stiff body posture around other people. So So, what are the thoughts and behaviors that can be signs of social anxiety disorder that include being very self conscious in front of other people? You know, I said the spotlight syndrome, right? They're very self conscious that पता नहीं कोई मेरे बारे में क्या सोच रहा है, ये सोच रहा है, वो सोच रहा है, all the khichdi in the mind. So feeling embarrassed or awkward in front of other people, feeling your mind go blank and not knowing what to say to other people. You know what, sometimes it happens that suppose if I prepare 100% for the presentation, I can only remember and give 85% of the presentation, but that is quite normal. Okay, but here in social anxiety disorder, even if they prepare for 100%, they can't even give 10% of what they have prepared, or they can't even start speaking. That happens. So this is extreme, feeling very afraid or worried that other people will judge you negatively or reject you. You know, feeling of rejection is so much, finding it scary and hard to be around other people, especially strangers, avoiding places where there are people. You know, generally they avoid people, like social gatherings and people. So, after all this, how is it exactly diagnosed? Social anxiety disorder can be diagnosed, you know, by the to diagnose social anxiety disorder, a qualified mental health professional typically conducts a comprehensive assessment, which may include what all are included is a clinical interview. The mental health professional gathers information about the individual's symptoms, history, and experiences related to social anxiety. Next, the diagnostic criteria. The professional assesses if the individual meets the criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders. We, therapists and psychologists and psychiatrists have a manual called DSM. Now the edition is DSM-5. That is Diagnostic and Statistical Manual for Mental Health Disorders. So we check the symptoms from those manual, and see for a diagnostic criteria for an absolute, like, diagnosis. Self report measures, and self report measure is standardized, you know, questionnaires or scales that may be used to assess the severity. This is to assess the severity of social anxiety symptoms and their impact on individual individual's life. And we do a differential diagnosis. The professional differentiates social anxiety disorder from other mental health conditions that may present with similar symptoms, such as generalized anxiety disorder or specific phobias. So, we rule out all the medical causes, and the medical causes also have to be ruled out. The medical conditions, substance abuse, or medications sometimes. Are the medications causing social anxiety, or is the person, having substance abuse? All these have to be checked, like clinical interview, diagnostic criteria, self report measures, differential diagnosis, and ruling out medical causes. Then the professional may review the individual's medical history and conduct appropriate medical evaluation. If it is necessary, a medical history is also evaluated. So, a healthcare provider, such as clinician, psychologist, and psychiatrist, or a therapist, can diagnose a person with social anxiety disorder based on the criteria for social anxiety disorder listed in the Diagnostic and Statistical Manual of Mental Disorders. So, that is DSM-5. So, it is published by American Psychiatric Association. So, we all follow that. So, what are the criteria here? Experiencing continuing or intense fear or anxiety about social situations because you believe you may be judged negatively or humiliated by others, avoiding social situations that may cause you anxiety or enduring them with intense fear or anxiety, experiencing intense anxiety that's out of proportion to the situation, experiencing anxiety or distress from social situations that interfere your day to day life. So, experiencing fear or anxiety in social situations that aren't better explained by a medical condition, medication, or substance abuse. This is differential diagnosis. We have seen the symptoms, and what the person does is the intense fear or anxiety during the situations, and the self analysis of the personal performance and identification of flaws in interaction. See, self scrutinization is also there in social anxiety disorder. A person is self criticizing and self scrutinizing, thinking that person is inferior. And these are all on the physical signs and symptoms may include fast heart, increased heartbeat, trembling, sweating, stomach upset at times, nausea. Person may have diarrhea, that is loose stools out of nowhere. He stomach upset happens, or nausea happens, or loose stool happens. And sometimes there is a trouble catching your breath, sometimes there is a headache, sometimes there is dizziness and lightheadedness, and sometimes there is stiffness of muscles, that is muscle tension, and feeling of your mind has gone blank. There is nothing in the mind, as I have already mentioned. So treatment, so what can be done in what are usually done in the treatment? First I will mention what are the treatment measures, and then I'll mention what we do here. So therapy, for the first thing which is done, one thing is therapy, one thing is medication. The psychologist and the psychotherapist do the therapy part of the thing, and the psychiatrist, if there is an severe social anxiety disorder, medications are prescribed. The antidepressants and the serotonin reuptake inhibitors, benzodiazepines, etc. are described. And medication should be taken under the guidance of a psychiatrist only, a healthcare professional. So therapy is majorly important than medication here. So I have just outlined the medication thing, but the therapy is important because therapy, cognitive behavioral therapy, is commonly used to treat social anxiety. It helps individuals identify and challenge negative thought patterns and beliefs, develop coping strategies, and gradually face feared social situations through exposure therapy. So this is the thing. And what we do is, first is therapy, next is some lifestyle changes, that is engaging in regular exercise, practicing relaxation techniques, that is deep breathing and meditation, and yoga, maintaining a healthy diet, and getting efficient sleep also can help. Lifestyle and diet also play a very important role in any physical or mental health condition. And support network, that is seeking support from family, friends, support groups, this also provides encouragement and understanding, sharing experiences with others who have social anxiety, who have overcome social anxiety. This support is also very needed. And self care, practicing self care activities that promote self compassion and stress reduction, that is hobbies, mindfulness, and self reflection. All these, this is a ladder of, when you approach a therapist, they mention all these things. It has to be an elaborate and holistic approach for of treating any mental health disorder and social anxiety disorder in particular. So it is important to note that Social anxiety disorder varies in severity among individuals, and treatment approaches may vary accordingly. Consulting with a mental health professional is crucial for an accurate diagnosis and to develop a tailored treatment plan. So, various treatment options can help people manage their symptoms, gain confidence, and overcome their anxiety. Without treatment, however, social anxiety disorder may persist throughout life, though it may feel better or worse at certain times. So you have to approach a doctor when you feel that the symptoms are out of your hand. That is, you are not able to manage the anxiety, and it is interfering anxiety, fear, and fear of rejection, and you have physical symptoms at though that are interfering in your day-to-day activities, then you should definitely consider going to a psychologist or a psychotherapist or a psychiatrist. See, psychotherapy or talking therapy helps people understand their experiences and develop effective coping methods. What we do is we practice cognitive behavioral therapy. There are interpersonal therapies, there are psychodynamic therapy, we do family therapy, we include family as well, and family of the client, and we do counseling with them also, so that client starts sharing things and experiences with their family members, and we tell family members to follow certain coping strategies as well. So cognitive behavioral therapy is a common treatment. So, what we do in cognitive behavioral therapy is an effective approach for, in this case, for managing social anxiety disorder. It focuses on identifying and modifying negative thought patterns, beliefs, and behaviors that contribute to anxiety. Here are the some important CBT techniques commonly used in the management of social anxiety. First, what we do, or what techniques of CBT we use. I'm just going to mention a few of them. That is cognitive restructuring. What is cognitive restructuring? Is restructuring your thoughts. Cognition is thinking. Restructuring your thinking. The word meaning itself tells you all. That means this technique involves identifying and challenging negative thoughts and beliefs associated with social anxiety. Individuals learn to recognize automatic negative thoughts and replace them with more realistic and balanced thoughts. So, for example, how do you replace a thought? It's just an example. See, when a person is going to speak in public, he thinks that everyone, if I speak, they will think that I am incompetent. What is cognitive restructuring? That I have some skills and knowledge that can contribute in the way of me being competent. I am not incompetent. It's to so telling I am not incompetent in a different way. You know, see, if you tell a person not to do this, not to do that, in the way the mind always thinks in that direction. So you are diverting the thought to a positive thought. That means negative thought is being replaced by a positive and more realistic one. I don't say in one sitting you can do it all. So we'll start. It is a ladder process. You step a ladder, you step a ladder, you step a ladder. Like that we do. So self monitoring. So first is cognitive restructuring. So, and second is self monitoring, keeping a record of anxious thoughts, physical sensations, and the situations that trigger social anxiety helps individual gain insight into their patterns. They learn to identify specific triggers and the thoughts associated with them, which can be addressed through cognitive restructuring. Again, to cognitively restructure the thoughts of the client, I have to know, as a therapist, I have to know what are the thoughts, what is his core belief. I have to know the problem, the root cause, to fix the problem. So for the knowing the root cause, what we do is self monitor. We tell them to self monitor what all thoughts you have, and we tell them to journal the thoughts, so that the next time he comes with all that, we can just restructure, we can do cognitive restructuring of the thoughts. So self monitoring for that, for cognitive restructuring and behavioral experiments. So what we do in this technique is testing. This technique involves testing the accuracy of anxious thoughts and beliefs through real life experiences. For example, an individual may believe that everyone will notice their trembling hands during a presentation. They can, and they can conduct a behavioral experiment by giving a presentation and observing others' reactions, which often contradicts their initial beliefs. If a person, has a belief that, my trembling hands or my fear is visible to the public who are seeing my presentation, who the people who are seeing my presentation, and we actually, expose the person to that scenario, tell him to go and, present, see if they are seeing his trembling experience. Then actually what happens is, people cannot notice what happened. We don't have that magic to notice what happens in your mind or what happens to your body inside, inner. So this is all in the mind. So when the person himself or herself sees behaviorally experiments that people are actually not noticing all that, people are only concentrating on the, on what he speaking and how is he speaking, and what is the, what is the productive approach of what he is speaking. So that is being noticed. When the person, gets out of that self consciousness, then can we start treatment. Then can we, start cognitive reconstructing. And next is the exposure therapy. This therapy involves gradually exposing individual to feared social situations. So face your fears. So how we do that? In a controlled and supportive manner. If a person, has a social anxiety, even to go and to talk to the cashier in the grocery store, we tell them to just go and say hi to the cashier, or just, talk to the people at the store people at the store, say hi to the people, or say hi to the strangers, or talk, intentionally go and talk to, come out of the fear. To, get rid of the fear, you have to be exposed to the fear, you have to face the fear, that in real life situations, because the person has only imaginary fears. Those are not real. Everybody in the grocery store, or every stranger you meet is not scrutinizing you. Definitely not, because they don't have the attention span, time, or the intention to scrutinize that person. So all these fears are imaginary. So in real life, when he goes and experiences this by himself or herself, then they come to know that, all the fears are imaginary. So then slowly, gradually, and in a controlled and supportive manner, the goal is to reduce avoidance behaviors and desensitize individuals to anxiety provoking stimuli. Exposure therapy can be conducted in a hierarchical manner, starting with less anxiety provoking situations and gradually progressing to more challenging ones. First, we give less challenging tasks, then we give more challenging tasks. Later, we raise the level of, challenges, so that a person could come out of social anxiety. And social skills training, this is also important. Individuals with social anxiety may benefit from learning and practicing specific social skills. This may include assertiveness training, effective communication techniques, and conflict resolution strategies. We may tell him to take some courses or start watching some videos or practical sessions on how to speak, effective communication, and assertiveness trainings. And what it does is, social skills training helps individuals feel more confident and comfortable in social interactions, reducing their anxiety. Next, relaxation techniques. Teaching individuals relaxation techniques. The most important thing is when their breathing increases and when they feel anxious and nervous, the deep breathing, to concentrate on your breathing is really important. Deep breathing and progressive, if they have muscle stiffness, muscle relaxation exercises, stretching exercises, mindfulness exercises helps them to manage physical symptoms. Like yoga also can be done. These techniques can be used before or during anxiety provoking situations to promote relaxation and reduce tension. If in daily life, if they adapt or adopt to relaxation techniques, gradually they can the fear or and the nervousness start decreasing, and it helps with the social anxiety as well. Okay, all these and these CBT techniques are typically used in combination tailored to the individual's needs and preferences. So the therapist guides the individual through the process, providing support, feedback, and encouragement. With consistent practice and implementation, these techniques can help individuals with social anxiety manage their symptoms, change their thought patterns, and improve their overall well-being. So, I will talk about the case studies and how to manage. I have given the techniques. I will also talk about self-help techniques and the case studies in my coming session. And this session was inclusion from my mental health awareness series and self improvement and self help on mental health. And all my videos are educational, are for educational and informational purposes only. If you have severe symptoms, please kindly approach a psychotherapist or a psychiatrist or a counselor accordingly. So thank you, and that's it for today's session. I'll be back with another session soon. So thank you if you have stayed tuned till now, and namaste.